Well, it's not just the elderly at risk from the coronavirus. Young children can also contract COVID-19. The symptoms are generally mild, but they can still infect other people. Laura Ingle spoke to a doctor about what parents should be looking out for in the middle of all of this. She joins us now live from Long Island. Hey, Laura.
Hi, Sandra. Well, in fact, the reality that children are being diagnosed across the country with COVID-19 is certainly changing the narrative. We had heard, of course, that it wasn't going to be affecting the very young, but in fact, these cases are now appearing throughout the nation. And it has really changed the way that young people, parents, and caregivers need to think moving forward, that you cannot let your guard down at any point as we move through this crisis. Now, reports of children have ranged in the U.S. from 7 months old to teenagers who at first appeared to have relatively simple cold and flu symptoms like fever, cough, and congestion, which then escalated quickly and required hospitalization. Now, we have confirmed exclusively this week that the nation's youngest known patient, an infant just 3 weeks old, tested positive here on New York's Long Island at NYU Winthrop Hospital. The baby has since been released and is now home recovering. Pediatric specialists say children who are experiencing even mild symptoms can be a big risk factor for others in the family home, especially seniors. And they say to keep a very close eye on fevers and respiratory symptoms with young ones and call your pediatrician right away to talk through the next steps.
And then they are going to guide you. They're going to tell you, okay, if there are mild symptoms, if you can take care of them at home, just with the fever control with the Tylenol, if you can make sure they're eating and drinking, then you just stay home and it's going to recover.
The good news is that most of these cases are mild, but of course, you've got to keep your eye out and call your doctor immediately if you see those symptoms. Sandra, back to you.